Professor Hok Bing Thio. He is a Vice Chair from Department of Dermatology and Venereology, Erasmus Medical Center, Rotterdam, Netherlands. He has been a principal investigator of various clinical studies and translational research on psoriasis and atopic dermatitis. He is holding a post of multiple committee members, particularly Dutch Medical Specialist Registration Committee, Dutch Guidelines Committee for Systemic Therapy in Psoriasis, as well as on chairman on Dutch Multidisciplinary Guidelines Committee Diagnostics of Small Vessel Vasculitis, as well as in European member of European Guidelines Committee Systemic Therapy for Psoriasis, member of Concilium Dermatological et Venereologicum of the Society of Dermatology and Venereology. He's been as a chairman of currently been a chairman of Dutch Multidisciplinary Guidelines Committee for Chronic Pruritus, and he's a recipient of special awards like the Golden Leaf Dermatology Award in 2010 and Professor Dr. E. Van Brix 2011 award in the field of psoriasis patient care. He holds multiple publications to his credit. He's going to deliver a lecture on microbiota and dermatology. Over to you, sir.
Thank you very much, Dr. Madam. So, good morning, everyone. And I hope you have a wonderful day today in India. It's a little bit gray outside here, a little bit raining. And what we are going to do in the next 30 minutes is just to bring you to make you happier with all the microbes you have on the skin, but also in your gastrointestinal tract. You know, as a dermatologist, that we are dealing with microbes, like here on your scalp, there is this like seborrheic dermatitis or pityriasis capiticica. That's the Malassezia pityrosporum, causing inflammation and a lot of itching. And of course, in acne, we know that the Corynebacterium. Yes? First of all, once again, I'd like to welcome you. And I have to disclose and disclaim myself. As you can see here, I'm related to many biopharmaceutical companies as a dermatologist, working in the field of psoriasis. What are we going to do? This microbiota thing, we know as a dermatologist that we are dealing with microbes, like here in Pityriasis capiticica or seborrheic dermatitis of the scalp. That Malassezia or pityrosporum is a microbe that you have to deal with. Otherwise, you can't stop the inflammation. Or in acne, the role of Cutibacterium acnes is very clear. We need to do something about this Cutibacterium acnes to treat acne. So, what are we then talking about? Microbiota is the term we use for all the microbes we have. So bacteria, viruses, and also fungi, while the microbiome are the genes of these microbes, the total of the genes. That's the use of the terms microbiome and microbiota. Many people use microbiome while they are talking about microbiota. So I stick about the microbiota. We are not talking a lot about the genes, but more about the microbes themselves. You can see here that in the last 6-7 years, there are a lot of interest to study this microbiota. And the headquarters of microbiota is not on the skin. We have a huge organ, skin, 2 square meters, but still the gastrointestinal tract. That's the headquarters of the microbiota. That's the main area where the microbes live. As you can see, there are differences in stomach, duodenum, the small intestines like jejunum, ileum, and colon. There are different inhabitants of your microbiota in different areas of the gastrointestinal tract. The most important microbes living in your gastrointestinal tract are located in the ileum and at the beginning of the colon ascendens. Yes, that's nearby the appendix. Those are microbes who are in direct contact with the buyer's patch. This is this gastrointestinal associated lymphoid tissue, GALT. This is a lymph node XXL, very large lymph node with almost 60% of your lymphocytes living there in your body. And so this is the most important area if you want to do something about the immune system by using the microbiota. And if we are dealing with microbiota in your gastrointestinal tract, that's almost 2 kilos of microbes you have in your gastrointestinal tract. And maybe I have to show you once this slide. Is you can see here that gastrointestinal tract has 2 kilos of microbes. We have, as a human being, 22,000 genes, but with all the microbes, we have almost 3.3 million genes. And we have a lot of more viruses than bacteria, 5 to 1, in our gut microbiota. And here are the impressive numbers of your microbiota. If you want to remember something, the 2 most important microbiota inhabitants in the gastrointestinal tract are the Firmicutes and the Bacteroides. Those are the most dominant bacterial species. So once again, buyer's patch, those are the most important microbes of your microbiota acting on your immune system. The communication microbiota immune system is here. This is the most important location of your microbiota immune system interaction. And the T cells who are involved, the most important T cells are the Th17, also important in psoriasis, of course, but also in inflammatory bowel diseases. And the Tregs, who are the inhibitory T cells, as you can see here, by producing like interleukin 10 and TGF-beta, it inhibits inflammation. So if you have an inflammatory disease like psoriasis, you like to promote the Tregs, so you inhibit then the inflammation. So if you want to do with fecal transplantation or with eating something good, you need bacteria who stimulates the Tregs or inhibits the Th17. In that way, you inhibit the inflammation. But on the other side, if you want to attack infectious diseases, then of course you need a stronger immune system. Then you need bacteria who stimulates the Th17 and inhibits the Tregs. And in that way, you get a stronger and a better immune system to attack infectious agents. So, till now, I'm talk to you about this these headquarters, this microbiota, the most important microbiota in human body, 2 kilos of microbes you have in the gastrointestinal tract. There's the most important location is the ileum cecum area, no, ileum, sorry, the ileum area into the colon ascendens. There is the contact of the microbiota and the immune system. And the buyer's patch, the lymphocytes who are acting as the most prominent players in these communications are the Th17 and the Tregs. Now you're coming to the skin microbiota. Please remember that we have 4 different skin areas for microbiota. So we have 4 different kind of zoos, as you can say that microbiota is a kind of zoo with a lot of animals in it. We have the oily area, sebaceous gland rich areas. That's almost in the face here, but also, of course, here, the pre-sternal areas. And the most extensive microbiota is located in the dry area. And here in the elbows, but also in the knees, the moist area, that's, of course, very important in atopic dermatitis. That's the moist areas. And there is a special place for the foot where the fungi are prominent. So please remember, for the skin microbiota, there are 4 different anatomical areas, and it's called sebaceous gland bridge areas, moist areas, dry, and the foot. And don't want to make you very confused with this picture, just only showing you that many microbes we know from as a dermatologist in the patient care, just like showing you that in the moist area, so in the elbows, molluscum contagiosum virus is one of the members of the microbiota in the moist areas. If you're looking at the foot, then you see here that also the Trichophyton rubrum is a microbe of the microbiota. But if you then, normally speaking, they are there doing nothing, but if they have a kind of an overgrowth, then you have dermatomycosis, the real inflammatory reaction to the Trichophyton. So this is an overgrowth of the virus with an inflammatory reaction. Then you see, as a dermatologist, this molluscum contagiosum. Once again, it is normal that every one of us has molluscum contagiosum virus in the moist areas of the skin. This is also an important one. Where do you have the most diversity? That's in the dry microbiota. While in the most sebaceous, in the face and on the scalp, there you see a lot of less biodiversity, and there's a lot of fungi in it, especially the Malassezia, the yeast. Let's go now for the acne. We know that Cutibacterium acnes is playing a role, a pathogenetical role in causing the acne in the sebaceous glands. So Cutibacterium acnes is a kind of a bad guy in acne, but you see also the Staphylococcus epidermidis, the red dot. These are microbes who are beneficial. So these are the good guys. So what you see in acne is that you have more Cutibacterium acnes, but less Staphylococcus epidermidis. What you want to have then is, this is a picture of a study in Korea, South Korea. What's happening with skin microbiota in the face if you are prescribing a therapy of doxycycline during 6 weeks. You see here this purple one, dark purple, Cutibacterium acnes, there is the decrease, what we expect, of course, but also you see an increase of the Staphylococcus epidermidis, the good guy. So this kind of reaction you want to have. The good guy is going up, the bad guy is going down. So once again, this Staphylococcus epidermidis was already published in Science in 2019 by the group of Jasmine Belkate, that the Staphylococcus epidermidis is playing an important role as a good guy. As you can see here, all the blue ones are beneficial effects for the skin health, the health of the skin. But you can also see here that there is a kind of a dangerous actions of the Staphylococcus epidermidis. Sometimes they are acting as a bad guy. And this is always fascinates me, what's happening here and what's happening there. But normally speaking, if you want to do something for your skin with a good bacteria, and you want to sell a cosmetic ointment, put that Staphylococcus epidermidis because you're not allowed to put live bacteria in your ointment. So epidermidis is a good guy. But remember, sometimes it promotes inflammation and it also promotes infection. And this mystery has been recently solved in this article of 6 weeks ago in Nature Microbiology. You can see here that the Staphylococcus epidermidis can express an aureus type wall teichoic acid, and then in that way to shift the good guy characteristics into a bad guy. And this is what's happening then. And this is why you can see here that there is a bad guy actions is due to this process, to this action of Staphylococcus epidermidis. What's happening in the gut, in the gastrointestinal tract if you're using tetracycline? You can see here that a lot of things are happening and they are acting on the metabolites produced by certain bacteria like the Bacteroides fragilis. You can see that the synthesis of butyrate is induced or stimulated by tetracycline. And in that way, you have also a general immune modulatory effect of the tetracycline. You remember, of course, that like tetracycline, doxycycline, we are using in acne. What it does is just inhibiting the protein synthesis in the ribosome, and the translation process is inhibited by these tetracyclines. Also, macrolides are doing this, inhibition of the protein synthesis in the ribosomes. So, the skin microbiota, important in skin diseases, but please remember that the major immune modulatory effect is in your gastrointestinal tract. And thereafter, you have other less important microbiota areas. For us, the skin, but also for the dentist is more the oral microbiota, or for the ENT specialist is there's this nasopharyngeal microbiota, or the gynecologist, we have the vaginal microbiota in your vagina. But of course, today we are dealing more with the skin diseases as a dermatologist, and I see here more the two most prominent inflammatory diseases for the dermatologist, psoriasis and atopic dermatitis. That we know that in atopic dermatitis, we have this Staphylococcus aureus causing the exacerbation, causing the inflammation in the skin. And maybe part of the Staphylococcus aureus are, as I told you earlier, the Staphylococcus epidermidis turning into a Staphylococcus aureus-like microbe, and in that way causing infection and inflammation in atopic people. For healthy people, besides Staphylococcus epidermidis, healthy people are people with healthy skin. The lactobacillus also very important in the skin for keeping your skin healthy. And in psoriasis, you see that many microbes are involved in here, a lot of Corynebacterium, but this is not solved yet. We have to do more research in this area, what's happening in psoriasis skin microbiota. So maybe in 1 or 2 years, we have more data in this field. So the plaque psoriasis is probably related by an overgrowth of some Corynebacterium. And Hester Eppinga is one of our PhD students, just here doing her PhD defense on the microbiome and the chronic inflammatory diseases, not only of the skin, but also of your gastrointestinal tract, the relation of inflammatory bowel disease and psoriasis and microbiota. So psoriasis is not only a skin dysbiosis. Now that's a new term, but dysbiosis means that there is a kind of a disbalance of the microbiota. Normally speaking, you have a kind of a well-balanced population of microbes in your microbiota. But if you see changes, then you get the disease. And you see here not only the skin, but also the gut and Faecalibacterium. We are not turning in, we will focus on that microbe, Faecalibacterium prausnitzii. That's the full name. Faecalibacterium prausnitzii. It's just like the Staphylococcus epidermidis in the skin. This is the good guy in inflammatory diseases. So what's happening? If you have an inflammatory bowel disease, you have less of these good guys. So you need to give patients with this inflammatory bowel disease. In our case, could be psoriasis. You need to give them Faecalibacterium prausnitzii. In that way, the immune system will be then inhibited. The Tregs going up, Th17 going down. And that's an important one. Faecalibacterium prausnitzii, you can modulate your immune system to be anti-inflammatory. So not only in IBD, but also in psoriasis, rheumatoid arthritis, or lupus erythematosus. This is what they are directly doing to your immune cells. This is the human dendritic cells. If you add Faecalibacterium prausnitzii in vitro together with the human dendritic cells, then you see a going up of the interleukin 10. So that means that we are going to the Tregs, the inhibitory modulation effect of your immune system. Another good guy in inflammation. So, I mean, this bacterium is an anti-inflammatory bacterium, is the Akkermansia municipula. This is a very, very, sorry, because once again, my Siri is getting lonely again, I think. And the case of the Akkermansia municipula, this is a very interesting microbe. This is a very interesting microbe, Akkermansia municipula, and you can see here that it inhibits inflammation, but it does also a lot of good things in type 2 diabetes or in hepatic steatosis. That's why this is a very interesting good guy of your gastrointestinal microbiota world. Of course, we are getting, for you, more into the lunch. For us, it's more breakfast. Knowing this about the microbiota in the gut, but also on the skin. Once again, in the skin, you have 4 different microbiota. In the oily part, moist, dry, and the foot. And then you can see that you have good guys and bad guys. The good guy in the skin is the Staphylococcus epidermidis. And bad guys, there are different bad guys, like in the seborrheic dermatitis, the Malassezia, or the Cutibacterium acnes in acne, or the Staphylococcus aureus in atopic dermatitis. And psoriasis, there's not sure, but Corynebacteria are playing an important role in psoriasis. But what you want is to modulate the disease, your immune disease, by diet. Is that possible? This is a science special issue on diet and health from 3 years ago. And yes, we can probably do something by using or prebiotics, probiotics, or postbiotics. What are these? See here, prebiotics are things we can eat to make the microorganism happy. So you give the best food for the bacteria you need to grow. Just like in the case I showed you earlier, if you want to have more Faecalibacterium prosnici or Akkermansia municifera in the gut, these are the good guys in inflammation, then you need to give them prebiotics like inulin or more a fiber snack. Then you get an overgrowth of your Faecalibacterium prosnici, then the immune system will be inhibited. And I showed you also earlier that the Faecalibacterium prosnici can interact with the immune cells directly, but also they're produced by fermentation, by fermentations of these prebiotics, they produce short-chain fatty acids. And short-chain fatty acids, SCFA, those are very, very trendy at this moment. And the most important one is the butyrate. Those called postbiotics. So once again, if you want to do it simply, just like in fecal transplant, you give the bacteria you need. In inflammatory disease, that's the Faecalibacterium prosnici or the Akkermansia. But you can also say, okay, let's eat something which is very nice for these bacteria, so then you have an overgrowth of these good guys bacteria. Or you said, okay, what do they produce which then can communicate with the immune system? Those are the short-chain fatty acids. So if you want to inhibit your immune system in your Peyer's patch, then you need also these short-chain fatty acids. So what you have now commercialized is symbiotics. Then you have combination of pre, pro, and postbiotics. Those are the most recent things you can add to your diet. But this is also another important thing to tell you that if you have a very salty diet, if you like salt in your food later on during the lunch, please remember a salty area, if the immune cells encounters a lot of sodium, a lot of salt, then they will get very active. Salty diet means a very active immune system. So if you have psoriasis, please use less salt. That's much better for your psoriasis. And of course, if you like meat or you are more vegetarian, you see differences. You can see it in your microbiota in the gut. And if you prefer more a ketogenic diet, high fat and low carbs, then you see here that you have an increased Akkermansia municifera. And Akkermansia municifera, that means an anti-inflammatory effect. So like in psoriasis, we always recommend patients to do more a low-calorie diet. That means that you can act on the Akkermansia municifera and it inhibits the disease activity of your psoriasis. And finally, I just want to tell you that exercise is very important. If you exercise not only slightly indoors, but very vigorously outside by running very, very fast, then you see here that the Faecalibacterium prosnici is going up, Lecnospira, but also this Akkermansia is also going up. So doing a lot of exercise means that it's not only healthy for your health, but also for your immune disease, because the Faecalibacterium and Akkermansia are going up. That means anti-inflammatory effect. Then maybe at the end, like just only summarizing what I told you in the past 30 minutes is the main microbiota are located in your gastrointestinal tract, 2 kilos. By your microbiota, have much more genes, 3.3 million genes we have now. And in that way, you can modulate your immune system by acting in the Peyer's patch microbiota immune cells. Th17 And Tregs are the most important adaptive immune cells for communicating with this microbiota. In the skin, we have 4 different areas, and we have good guys in the skin, Staphylococcus epidermidis, and in the gut, that's Faecalibacterium prausnitzii and Akkermansia municiphala. And you can try to do something by acting on your diet, by eating all probiotics, prebiotics, or together with the postbiotics is called symbiotics. And not only diet, but also exercise can have an influence on your microbiota, as you can see in my last slide. Thank you very much for your very kind attention.
Thank you, sir. It was a wonderful presentation indeed. I'd like to invite Dr. Dinesh Kumar to take up this session. Okay, so we have 2 questions so far. The first question is the role of Lactobacillus rhamnosus in atopic dermatitis.
Thank you very much for this question. Yeah. As you can see in the slide, atopic dermatitis, healthy, and psoriasis, there is this Lactobacillus rhamnosus who is acting as a health promoter in the skin. So yes, there is some kind of good effect of this Lactobacillus, but we need more trials to show these good effects of this Lactobacillus. But yes, there is a certain role, I think, not only in atopic dermatitis, but in many, many more inflammatory skin diseases. This is a skin health promoting effect of the Lactobacillus.
We have another question.
Yeah.
So how long do we need to supplement the Faecalibacterium prausnitzii?
Yeah, and this is probably a very long time, because if you are going to travel into Europe, your microbiota, your Indian microbiota, is probably changed a little bit into a European one. Like if you're going to Italy and you eat a lot of pasta, that means high carbs, that will change your microbiota. But after one day, you're going back to India, you get your own unique microbiota back. So everyone has a unique microbiota. So in that way, means that if you're going to supply Faecalibacterium prausnitzii and you skip 1 day or 2 days, going back to normal microbiota, which is more for the psoriasis, so you have to supply them every day.
Professor Thomas, Jacob Thomas wants to say something.
Professor Thio, thank you very much for that wonderful presentation.
You're welcome.
I am particularly interested in this topic. So just ask a few of my doubts. You were telling about staph epidermidis in acne. Now, I have been telling that for more than 2 decades. Yes, and people have not actually accepted it fully. They all are concentrating only on Cutibacterium acnes. Now, there is a new topical antibiotic which has come into India. I do not know whether you have it in the Netherlands or in Europe. Ozenoxacin. Do you think topical application of ozenoxacin might help?
I'm not sure. First of all, I don't have the experience you have, so I'm not sure whether but we need some studies of some data whether these are very effective or not effective. So I don't have this experience, so I'm not sure. But did you have the experiences?
Yes. We just got it about a month back, and
okay.
We're using it. We found it to be good, and okay. I am putting the whole thing to staph epidermidis. The next part of mine, Professor Thio, is we are talking about the dysbiosis. And when we talk about dysbacteriosis or dysbiosis, in atopic dermatitis, we tend to talk about the leaky gut syndrome.
Yes.
And in psoriasis, we tend to talk about the irritable bowel syndrome. And you also very nicely put a slide where at 2 ends, atopic dermatitis and psoriasis was present. I again believe that atopic dermatitis and psoriasis are two spectra of the same disease pattern. Can I have your feedback on that, please?
Yes. Do you mind that if I go back to my presentation, then maybe that this, Pastor Thomas, if you can see here, different areas of the world, so the diversity of these diseases, you see that Asian atopic dermatitis and psoriasis is in the immunopathogenesis almost a lookalikes. That's more a Th17 and Th22 stories. So yes, maybe it's one inflammatory skin disease, like the inflammatory bowel disease. You have the colitis ulcerosa and the Crohn's disease. Maybe we are like colitis ulcerosa is more the atopic dermatitis for the gastrointestinal specialist, while the Crohn's disease is more the psoriasis. Maybe we have to think that way. But on the other hand, we have genetic studies that we have these psoriasis genes and we have these atopic dermatitis genes. But some of these immune genes are involved in both diseases. So yes, I agree. Maybe it's kind of spectrum.
We believe about genetic factors, but we must also start believing about the epigenetic factor. And unless and until we put genetic and epigenetic factors together, these things become difficult. Now, we have all the while been thinking about atopic dermatitis and psoriasis, but it's time for us to think differently and get into something new. I wouldn't call it new normal, but at least put our brains into it and start thinking and start opening our eyes and ears to what others have got to say also. But thank you very much once again, Professor Thio.
Yes, I fully agree. And once again, I want to what you said about epigenetic. So I mean histone acetylation or deacetylation, and of course, it's not only stress, infection, or age, or where you live, or what you eat, whether you are a man or a woman. But also very important is your circadian rhythm can act directly on your immune system. If you like to sleep for 8 hours a day, but you only can sleep 4 hours because you're too busy, and you have to write many manuscripts or other things you have to do, then you have less sleep, and your circadian rhythm is then misaligned. And that means that your immune system is going into a Th2 side. So you have a lot more itching and more of your skin disease, especially in atopic people, if you don't sleep well. And this is the effect of your circadian rhythm on the microbiota and directly also on the immune system. But thank you very much for all the questions and all.
Very well put, Professor Thio. Thank you very much again.